It has been exactly a year and 4 months ever since the coronavirus outbreak was first documented in Wuhan, Hubei province, China, which has made the whole world experience some dire consequences. According to the World Health Organization, the coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Coronaviruses are known as the large family of zoonotic viruses which cause illness, ranging from the common cold to severe respiratory diseases. Zoonotic means these viruses are able to be transmitted from animals to humans. COVID-19 is the most recent to make the jump to human infection. The COVID-19 infection is identified to spread from one person to others via droplets produced from the respiratory system of infected people, often during coughing or sneezing. Although prevention methods can be carried out to prevent one from contracting the virus, the best way to have this situation under control is by getting the assigned vaccination. As of April 2021, Pfizer-BioNTech, Sinovac Biotech, and Oxford AstraZeneca are the 3 vaccines for COVID-19 infection that have been approved by the Malaysian government. The vaccines are made to protect the people from symptoms of COVID-19, but it is not confirmed whether they will stop the spread of the SARS-CoV-2 virus, the cause of COVID-19. Among the approved vaccines, Pfizer-BioNTech's vaccines use mRNA technology, where it works by injecting pieces of the virus's genetic code into the body to stimulate an immune system reaction, which enables the body to defend itself against the coronavirus. The mRNA in the body breaks down fully within 48 hours. As it does not enter the human nucleus, it does not affect human DNA. This Pfizer's mRNA vaccine requires 2 doses for adequate protection, and the doses are administered between 3 and 4 weeks apart. Oxford AstraZeneca and Sinovac Biotech's vaccines exert a modified delivery virus that usually causes symptoms such as the common cold to introduce SARS-CoV-2 viral proteins to the immune system, which then builds a defense against it. The delivery virus is attenuated or modified so the person does not develop the common cold when administered with this vaccine. However, lately, the public have raised their concern regarding the specific AstraZeneca vaccine, which has shown several side effects and adverse drug reactions such as blood clotting. The government took note of the public anxiety and doubt over this particular vaccine and decided that the AstraZeneca COVID-19 vaccine will not be used in Malaysia's mainstream national COVID-19 vaccination program, although the experts found that the benefits of using AstraZeneca outweighed the risks of blood clots. However, the government do not wish to waste this vaccine, which is considered to be effective and safe. So, special vaccination centers distributing the AstraZeneca vaccines would be open to the public who volunteer, after looking at all the facts regarding AstraZeneca, to come forth and register at the special centers to take the vaccine. The following decision was agreed upon a thorough discussion among the Ministry for Science, Technology and Innovation and the Ministry of Health to continue using the AstraZeneca vaccine and at the same time handle the fear and worries people have over the AstraZeneca vaccine, which in fact are not based on science. They have also stated how they are aware that there is a vaccine hesitancy due to the negative reports about it, and these hesitancies exist because of the thrombocytopenia and low platelet cases, but these reports are very rare. The reported risk of blood clots after taking the jab is about 4 in 1 million, according to data from Britain's Medicines and Healthcare Products Regulatory Agency, and the risk of death is about 1 in 1 million. Moreover, the public also hopes that once they are vaccinated, they will be entirely free from the COVID-19 infection, which is a false news. Just as mentioned earlier, the vaccines provide protection against symptomatic forms of COVID-19, but it is still unclear whether they will stop the spread of COVID-19 virus. Therefore, they must continue to take appropriate precautions in protecting themselves and others around them, even after receiving the COVID-19 vaccine. Though it is unlikely, but some people may still spread and even develop COVID-19 after being vaccinated. According to CDC, Centers for Disease Control and Prevention, it typically takes a few weeks for the body to build immunity and protection against the virus that causes COVID-19 after vaccination. It also suggests that it is possible for a person to be infected with the virus just before or just after vaccination and still get sick. This is because the vaccine has not had enough time to provide protection. When accurate facts like this are stated publicly, more people will start to gain trust and bring themselves to get vaccinated. With the amount of people receiving the vaccines increasing, the pandemic can be more easily brought down and be defeated. Recently, the Malaysian government has also promised to compensate individuals who might suffer side effects from being immunized. Vaccine recipients who suffer serious side effects that require lengthy treatments in hospitals stand to receive 50,000 ringgit. Meanwhile, those who suffer permanent impairments or death will get 500,000 ringgit. They have also stated that this actually represented the government's confidence in the vaccines. While the number of vaccines that are being imported into the country are increasing, the number of active cases so far have almost doubled since mid-April, climbing from 15,000 to 30,000 cases on Friday, 30th of April 2021. In this situation, it is encouraged that more people should get vaccinated as soon as possible in order to curb this situation from spreading any further. Therefore, we should all do our best to protect our loved ones and work together to contain the spread.